The CDC says someone in the United States has a stroke every 40 seconds. Every 3.5 minutes, someone dies of stroke. In today's To Your Well-Being, we're reviewing what we all should know about strokes. It could save your life or that of a loved one. So to help you do that, we have Dr. Ashish Arora with Cone Health Medical Group, and he's giving you all the information that we all need to start. Okay, so first and foremost, let's kind of set the stage here. Some folks think that only older adults, seniors, are the ones who are at risk for strokes.
That's actually not correct. We have been seeing strokes in all age groups, from as young as neonatal period to the elderly people, as you've said. So strokes can happen at any age group to anyone at any time.
Okay, and that is just a scary thought that is something that can happen no matter what. So how are strokes preventable? What steps and things should we be following?
Very good question. So there are certain things that we can't change about ourselves, our genetics, our hereditary things that we inherit from our parents and families. But the things that are under our control are the modifiable risk factors, such as controlling high blood pressure, quitting smoking, exercising regularly. More recently in the pandemic, we've seen association of blood clots that go to the brain and cause strokes with the COVID-19 infection itself. So if you are at high risk for COVID, get vaccinated and prevent yourself from being a victim of one of the complications that we've seen with the pandemic.
Mm-hmm. All right, so are there health issues that people should be aware of that increase their risk of having stroke? I know you had said the blood pressure, but what other things are we looking at?
So the other factors are advanced age, high blood pressure, high cholesterol, atrial fibrillation, which is an abnormal heart rhythm. If you have that, you need to speak with your doctor and your cardiologist to be on adequate blood thinning medications that can prevent your chances of strokes. Smoking, a big no-no and a big risk factor.
All right, and so what would you say to someone who thinks, okay, I think I have a family history of stroke, or I'm at an increased risk. Is there anything or nothing that I can do?
No, there are certain steps that everybody, irrespective of family history, but more so when you have a family history, you should be doing. You should be seeing your doctors regularly. You should follow their advice. You should get your blood tests checked. You should check your cholesterol. You should check your blood pressure. If you have high blood pressure, you should be treating that regularly and adequately under the supervision of your physician.
Okay, so I know that after the break, we're going to talk about the warning signs and what to do if you think someone is having a stroke, that, you know, it could possibly save a life. But is there anything that's just on the generic thing of, okay, we're just talking about strokes? And once again, I think we should reiterate that it can happen to any age group.
That is correct. You should be looking for signs of any sudden change that can happen in a person. And we'll talk about that later when we talk about the Be Fast. Any sudden change in neurological function should raise a suspicion for a stroke.
Okay, and so when you said we need to be seeing our doctor, especially if we have that predisposition, we need them to do the full blood work every single year.
Correct. And based on your risk factors, they might suggest you medicines. They might suggest that you only change your lifestyle and have exercise introduced more, change your diet and other lifestyle modifications. So it would be very specific to specific people. And that is why your doctor is going to be your best friend in determining your risks and preventing strokes in you in particular.
Mm-hmm. And this is one of those things where a lot of times, because of COVID, people just didn't get to see their doctor.
That is correct. And we are making all efforts here in our system and all the health systems nationwide so that we can provide access to our patients, whether in person or through telemedicine, to be able to get them to see their doctors in a more timely manner.
All right, so maybe we've been putting it off, or we weren't able to get the appointments and things of that nature, so we're urging you to get those preventative appointments made. All right, we're going to take a quick break and we will be right back.